Hi, I'm Sharon Knight, and I'd like to welcome you to our Building Community Together check-in. I am from Hope Communities, which is a nonprofit that's been in the Denver metro area for 40 years, offering housing, programs, educational resources, and resource navigation. One of the things that we also do is to create and engage in activities across the community to try to build that connectedness that we refer to as building community. And since we do have so many connections and we know how important it is to people, we thought it's really important now to check in with people when they're starting to feel a little bit more isolated because of this stay at home order. And we talked about doing this format because we thought it would be accessible to most people and also because it has a chat function. If you look at the bottom of your screen, there's a place to write chats and you can comment, you can sign in to let me know that you're participating in this, or you can type in questions. Frankly, sometimes I see them and sometimes I don't because I get so involved in this. But if we don't respond to the questions right now, we will respond to the questions later. I also know that not everybody can actually participate during this Facebook Live time, but a lot more people watch afterwards. And so if you are watching now and you know of anybody else who could benefit from this show, please share the information with them. Let them know where they can find it to watch it themselves. And also let them know that if they have any questions or any problems they need help during this time, that they can reach out to us at info@hopecommunities.org and just simply write an email to let us know what the need is. Or we have lots of resources on our website, specifically many more now for the COVID virus response. So that is at hopecommunities.org. We're there to help. We just need to know what's going on with you. So I'd like to check in and say, what is happening now with the virus? Well, I think most of you know, but maybe not, that the federal government approved another $484 billion to support a second round of relief package. So that will give us 320 billion more to replenish the Paycheck Protection Program, which went very fast for businesses trying to help to keep their employees in place during this time. There is about 60,000 or 60 billion, excuse me, for emergency loans and grants to small businesses through the SBA Disaster Aid Program, 75 billion more for hospitals and community health centers, and we all know they're screaming for help right now, and then 25 billion for COVID-19 testing, which all of our states are really craving. And we haven't been able to get enough of those tests, but this will really help. Earlier this week, Governor Polis announced that some businesses could go back to work. He was calling it a safe at home step versus a stay at home order, but that those going back to work would really need to use steep precautions, to wear masks, to have social distancing, and that we would all have to really be paying attention and change our strategy if the environment changed. So he's saying that some businesses can go back starting May 1st. And then he did remind us too that schools in Colorado will still be closed for the whole school year. Mayor Hancock later in the week extended the stay at home order through the first week of May. In his order, he's saying that people who are not working or people who are non-essential businesses should take a little bit more time before they transition back into the workplace. We're all being cautious, which we need to be because this is a really serious business. And even at Hope Communities, we're starting to strategize about when we offer a fuller array of our services in person, but it's going to be a gradual move, and we will keep you posted as things change. Right now, we still are seeing people one-on-one by appointment in person, as well as all of our remote navigation services and other types of support that we're giving to people. I just wanted to mention that and not to call anybody out specifically, but that one of the Walmarts, a Walmart Supercenter in Expedition Ave in Aurora, was shut down because 6 employees were tested positive for the virus. The reason I really bring that up, it is new news, but is to remind people that when you go shopping, not only are you using social distance in the store, and for goodness sake, masks are really a great idea. And if you're going to the stores, they don't always have hand sanitizer or any wipes when you walk in. So if you can get gloves, I think that's a great idea too. And then just to wash the goods that you bring home before you put them away. So we just never know who might have been in a store, who might have touched something, somebody might have had pre-symptoms of the virus or whatever. So just to be on the safe side, it's a lot better to wash those things off. And talking of safety, one of the other things that came up in the news, and this week, and I've heard it a little bit a few weeks before too, is that because of the stay-at-home order, many people are fearful of going out, even for essential appointments. And what we've seen is that the number of childhood immunizations has gone way down, and doctors want parents to know it's still important to go out and get those immunizations. So the doctors are keeping those appointments. So parents, please think about how you can get your kids in there. We don't want to get through this pandemic and then have another drastic situation that could have been prevented if our kids had gotten their immunizations on time. So I think it almost seems silly to say this, and we have talked about this before as a myth, but just because it was in the news, I will reiterate that our disinfectants that we use to clean our hands and our surfaces are not to be ingested. So we did have a news article where someone was saying that maybe if people drank disinfectant, that would help them prevent the virus. Of course, that is a myth, and that's not something that you want to do. Now, one of the ramifications of this, and there will be many for this pandemic, is that many people who have lost their jobs and don't have income are now hungry. That's why we've been focusing on food insecurity so much. The New York Times posted a story that said because of this situation across the globe, there could be as many as 265 million people who are pushed to the brink of starvation. And we need to pull together to help people not only have a safe place to call home, but to have the food they need to be healthy and to thrive and to get through this. So we have been stepping up our food distribution quite a bit. And if you have that kind of a need, please let us know. There's so much going on these days. It's almost overwhelming. There's so much news, there's so many changes, so many vulnerabilities. And we're just learning so much every day. And I know it could be frustrating, and just want you to hang in there. Here's my quote for the day. You will suffer, be tempted, and make mistakes. You will learn for yourself what every heroine has learned. Through overcoming challenges comes growth and strength. It is your reaction to adversity, not the adversity itself, that determines how your life story will develop. That's by Dieter Uchtdorf. So obviously we're all being tested in many ways, and I know that we are really strong. We can accomplish so much individually, we can accomplish so much together, and yet we do have frailties. And so today I'm going to talk a little bit about mental and emotional issues related to this pandemic. If you've seen some of the other videos that we've posted, you know that we've talked about health and wellness quite a bit. This one is going to reiterate best practices, but also do a little bit of a deeper dive into the mental and emotional issues that might be facing people today more than ever. It's a topic that's really personal, and it could be really sensitive, but it's really important to talk about. So I appreciate you being here with me today. Now, if you just joined, I am Sharon Knight. I am the president and CEO at Hope Communities, and we're checking in with you to provide information, inspiration, and activities to help you get through this period. One thing that people are really worried about with all of the increased fears and the social isolation and the confinement is depression. So depression, as many of you may know, is a mood disorder that is, in very, very general terms, it causes someone to feel extreme and ongoing sadness, a loss of interest, and just melancholy. So symptoms might include that sadness, being really tired, trouble focusing, anger, frustration, maybe even a sense of worthlessness. It can be periodic. It could be related to a specific event or an activity or series of events like we're going through now, or it could be more long-term. And almost everybody feels down sometime. And we might even say that we're depressed now and again, but I'm talking about something that is deeper than that, deeper than a cursory feeling that we're having at any given time. So sometimes you can really respond to this in a natural way with the foods you eat and the exercise you have and different things like that you have complete control over. And then sometimes you need medication to get through. So we're going to share a little bit of contact information and resources in case you think you might need a little bit of support. You also could be feeling anxious about the coronavirus. Well, if you are not the only one. It's really normal to feel worried during stressful times. People regularly feel stress around work, around financial concerns, if there's a serious medical condition or major events, again, that are impacting one's lives, especially if we feel like we're out of control. And right now, a lot of us feel like we don't have control of anywhere near as many things as we normally do. So that could make you more anxious. Again, you're not alone. A lot of people are feeling that way, and it's okay to feel that. I mean, you have to understand that there's a real seed for this to develop within you, and it's okay to feel it, to identify it, and then to try to figure out how to deal with it. So, sometimes when people get anxious, they will get agitated, they're excessively worried, and they can be really tense. Sometimes they're really irritable and might even strike out, or sometimes they do the opposite and they withdraw. Sometimes high anxiety will lead to panic attacks, and those attacks will make you have shortness of breath. You might be sweating. You might have an increased heart rate, like you feel like your heart is just like beating really, really fast. You might have nausea and sometimes fear that you're actually going to die. So if you have some of these symptoms and you can't control it, I mean, there are some things you can do to try to be centered and to try to do deep breathing and try to do a little exercise. If those things are not working, please think about reaching out to get some help, somebody to talk with. I mean, it could be that you can reach out to your family or your friends and be able to work through these things, but sometimes you also need to have a professional that can help you. So a couple of organizations, or a few, that might be able to help with some of these issues. The Mental Health Center of Denver is providing support for clients primarily through telehealth, as most of our providers are right now, like phone or like video. So to access their services, you can call 303-504-7900. And there's also, you can set up your first appointment. Somebody will either answer right then or get right back to you. And then there is a walk-in center on Colfax, 4353 East Colfax, that you may be able to also get support through. The Colorado Crisis Services is another organization that could help. You can call 844-493-8255, or you can text TALK to the number 38255, and you can get someone who can help you. The Charge Resource Center has many locations. They have limited hours now, and you can call 720-316-4447 to set up a time to connect with them. And then I may not say this correctly, Servicios de la Raza actually provides culturally and linguistically responsive outpatient mental health services in English and in Spanish, and they can be reached by calling 303-458-5851. The Asian Pacific Development Center, which is in the East Colfax corridor, has mental health services for clients primarily through telemed right now, but they have navigators and counselors who have many languages. So it's particularly helpful for some of the newcomers in our area. And you can call 303-923-2972. And the center is another place that could be good for some individuals experiencing mental health issues. They are specifically welcoming for LGBTQ communities, and they are located on Colfax Avenue as well. Now, if you or someone you know is experiencing thoughts of suicide because things have gotten so bad, and you are not able to get help at this point by one of the other providers that we just mentioned, you can also call the National Suicide Prevention Lifeline. It's 24/7 service, and it's confidential. And that number is 1-800-273-8255. So I know this is a tough conversation, so thank you for hanging in there with me. We just know that people have been pretty tense during this time, and some people have the ability to get out or to deal with these things and to help remediate some of the pain that you're feeling, and others can't. And one of the things that some experts are concerned about would be domestic violence or household violence. And oftentimes when there is a pandemic like this, or some other big critical emergency, it could be a hurricane or something that keeps people in the home, there's like a slight dip, and then there's an escalation in these types of demonstrations of violence. And so we definitely do not want that to happen. Amy Paul, who's from Violence Free Colorado, mentioned that they are getting more calls right now. So just to be proactive, if you feel like you or someone else that you know has pent up anger and it could be released inappropriately, it might be a good time to reach out to one of those mental health specialists to just get a little guidance on things that you can do to ease the stress. And then also, we just want people to know that even though you're on a stay-at-home order, if you feel like you have been abused in some way, you don't have to tolerate being in that environment just because we have that stay-at-home order. There are still organizations and people who can help you. So there's a few lines that I'll give you right now. The National Domestic Violence Hotline, the number is 800-799-7233. We'll write these on our website later. Safe House Denver is 303-318-9989. And the Rose Andom Center is 720-337-4400. Those last three specifically target domestic violence. And then the Kemp Center is for the prevention and treatment of child abuse. And their number is 303-864-5252. Of course, if you need help and you don't see or can't find these numbers or the names of these organizations, you can always reach out to our navigators, and they can help to direct you to the right place to go to get the service that you need, because we certainly want everybody not only to be healthy, but we want you to be safe throughout this whole pandemic. And so please let us help you. If something like this is going on, we can help find services for people who need to deal with anger or deal with depression or anxiety. and we can help with resources for people who need some relief because they feel like they have been experiencing some kind of abuse. We really want to be there for you. Now, some things that you can do that if you want to try to remediate this yourself, which probably is a little bit of a lighter type of intervention for you at this time. I've said this one before. Turn off the news. Don't watch it all day long. It can just literally drive you crazy and make you very, very nervous and tense. So catch up on news a little teeny bit in the morning and a little teeny bit in the evening maybe, but don't watch it all day long. You need to take care of yourself, of course, in terms of eating and exercise. If you give support to someone else, it really does help you to feel better. And so reaching out to other people to check in on them, even to share your feelings, to talk about your frustrations can be so, so helpful during this time. And social isolation just eats at us. So, take a few moments every day at least to try to reach out to people. There's lots of different apps that can make this easier for you. FaceTime, if you have an iPhone or a Mac computer, you can just have a face-to-face conversation with people very easily, almost any time. It is just an Apple platform, though. Google Duo is almost a FaceTime type of app, but it can go on any device. And so it's much easier for an Android phone, for instance, to use the Google Duo app. And then they have a similar app for desktop that's called Google Hangouts, and you can have like a conference call with lots of people. Marco Polo is another app that kind of combines texting and social media and video chats. Of course, Skype, we've used that for quite a while for conference calling or just regular phone calls. A lot of people are using Facebook Messenger to get conversations through because they can look at kind of the pictures, the posts from people, and then do private messages in a free format that way. Some people are doing Netflix parties where you can set this up using an actual app that's called Netflix Party, where you watch a movie together. And then there's another one that's called Watch Together. So if you don't have Netflix, which is of course a paid subscription, you could do Watch Together also and watch movies. And then Zoom, and we've talked about Zoom. And you could look at some old-fashioned ways to get together too. I mean, how often have you gotten a letter recently? A letter or a postcard? That would be really fun to send to people, to start a little letter writing campaign. So think about that for yourself, or reaching out to your friends. Or if you want to carve out some time, it would be really nice to write some letters to maybe some seniors who are in nursing homes, especially now if they're extra isolated because of the pandemic. So you could find some ways to really improve the lives of a lot of people. There's actually a website that's lovefortheelderly.org and then /letters, and they will help you to target letters for people who really need them. And then you can always talk to people. If you don't actually have friends or family that you can talk with, there's a line that's called quarantinechat.com where they will connect you with people just to talk, to touch base, so that you do have somebody else who's checking in on you. So lots of different ways to try to connect, to increase our social ability to make that personal engagement, and also maybe to release some of the tensions in our life. And this is kind of controversial, I guess, and at a time when during the stay-at-home order, so many people are kind of staying in their PJs all day, or their sweats all day, or they're not wearing makeup, or they're kind of adapting a grunge look, and it is in alignment with staying at home. But if you have always felt better by getting up and showering and getting dressed, or putting makeup on, or dressing professionally for work, do it. You don't have to do what everybody else is doing just because that seems to be a trend. If it would actually make you feel better to do something else, I just think you need to to do that. So everybody responds differently to all of the stressors that are around us. And everybody responds differently in terms of what will help them to get out of a depressed mood or to help them feel better about what's going on. And so you have to be really attuned to, where you are, what you're feeling, what you need, and be able to try to find a plan that works for you to help you feel better through this time. A lot of people have been talking about meditation and trying to, figure out what are ways to calm themselves down. One of my friends, Julie Voss, she's been doing a meditation Facebook Live, actually, session at least once a week. And one of the things she said about that is that when the surface is wavy, we can dive deeper for calm waters. I just love that. I mean, we've got to be able to see the waves, to deal with all of the things around us, and then to dive deep and figure out, okay, first let's be calm, and then let's figure out how we can make everything else in our life calm, or at least calmer. Again, we don't have control of everything, but if we can try to be intentional and try to navigate through all of these issues really carefully, knowing ourselves and customizing it to ourselves, I think that we'll be able to get through this a lot easier. And certainly, as I have said several times today, if you need Hope Communities staff to help you to navigate these murky waters, please reach out at info@hopecommunities.org. I always do a book review or talk about a book review during these sessions. And today's review is going to be posted a few minutes after this show, and it's by Lynn Dolvin. She is previewing a book called In the Time of Butterflies by Julia Alvarez. The book was written about these courageous Mirabal sisters during a Trujillo dictatorship in the Dominican Republic. It sounds like an amazing book. I have not read it. There was also a story. The story was made into a movie in 2001 that featured Salma Hayek. I didn't see the movie either, but I think I really want to do it now. It just sounds wonderful, and it's great to see the courage that these sisters have found to take part in their very different and customized way, take part in a rebellion against a dictatorship that, of course, many of us probably heard about, was destroying lives for many, many years. So it sounds like a great book. We'll post that in just a few minutes. And I'm actually going to have another quote that I share with you today to close out the show. It's by Elizabeth Kubler-Ross. And here it is. The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These persons have an appreciation and a sensitivity and an understanding of life that fills them with compassion, gentleness, and deep, loving concern. Beautiful people don't just happen. And I know we have a lot of beautiful people out there. We're pulling for you. Please reach out if you need some help. Have a wonderful weekend, and please come back and see us again Monday at 3 o'clock when we do our next Facebook Live. Thank you.